Hello my dear students, today we are going to see about hospital admission and transfer. Okay, so let us start with admission. What do you mean by admission? Hospital admission is defined as allowing a patient to stay in hospital for this three main reasons or four main reasons which are there: observation, investigation, treatment and care. Now just understand what we are talking here. We are talking about admitting a patient to the hospital. Okay, now it is a very much difficult situation for the patient and the relative. Nobody wants to get admitted to the hospital because as much as possible they like to get the treatment at their home, but when they are not able to take care of themselves at home, they need to get admitted to the hospital for an advanced care or a care by a nurse or by the physician. Okay, are you understanding? So it's very important that we should know, as we are paramedical field personnel, we should know how to take care of the patients and the clients who are admitted to the hospital and what is the process for it. Okay, so admission is nothing but where a patient is getting admitted where to the hospital, and for many reasons it can be. The first reason which is listed down over here is observation. Now what do you mean by observation? Observation means here we are going to just observe our patient. Now for example, a patient who had a heart attack, or who is feeling breathing difficulty or such problem is there, so we have to admit him to the hospital and then start him on oxygen or give him some medicine so that he feels better, and then observe the patient. Okay, so observation is commonly done so that we can save the patient's life. The second is investigation. Investigation means what? Sometimes some patient get admitted, like if there are various procedures like angiography and all. The different procedures are done in order to know what is the blockage in the coronary artery. Okay, just an example. So such procedures, if they want to undergo, they get admitted to the hospital and conduct the investigation, and after completion of the investigation, if the results are bad, then they go for some treatment or they undergo surgeries. If the results are good, he may be discharged. Okay, so that is investigation. Next is treatment. Maximum time patients are admitted for the treatment, medical surgical treatment in the hospital. That is, medical treatment means what? Just getting some medicine and other care. Treatment, surgical treatment also means what? Undergoing some surgeries, right? So that's the treatment and the care. Care, who is the main person giving care to the patient? Is us, the nurses, who are giving 24/7 care to the patient, right? So for all this purpose, a patient is admitted to the hospital. Okay, so admission is defined as allowing a patient to stay where? In the hospital. For what reason? That you are going to mention. That is observation, treatment, investigation and care. Okay, so this is the definition of admission. Hope so you understood. Next we move on to the admission purpose. What do you mean by purpose? Why we are admitting a patient? We have already seen the definition, the reason, many reasons, but let us understand the specific one. The first one, to make the patient feel welcome, comfortable and ease. Very important. Whenever we are admitting a patient, we should make our patient feel at ease. Okay, it should not be that patient is getting more frightened or he is having more anxiety after admitting in the hospital. So it's our responsibility to take care of our patients. Okay, so he feels welcomed, comfortable. Okay, comfort. Now how can you welcome? It's not something which you are grandly welcoming him. It's just that when the patient comes and he's not too sick, okay, he's what I mean by too sick is an emergency condition where he's not able to breathe and all. That time emergency treatment has to be given there. You don't sit and explain him that this is your bed, this is your locker. We never explain. But a patient who is little sick, and then you can explain him because he is getting admitted to the hospital. So you have to explain him that this is your bed, this is the locker which is given to you, or this is a call bell where you can call me at any time if you need me. I will be there with you. So when we are this, how we are talking makes the person comfortable. Okay, he feels ease. Okay, that he is being made familiar with the surrounding. Are you understanding? And then you are taking care of all the requirements of the patient, right? Next is to acquire vital information regarding the patient. So when we are admitting a patient, we are also collecting all the vital, means important information from the patient by taking history, doing physical examination, checking all the previous records and all, right? To assess the patient, from which a nursing care plan be initiated and implemented. What do you mean by assess? Because as the patient is getting admitted, we always do an admission assessment of the patient, initial assessment of the patient, so that nursing care plan, we had seen nursing care plan, we have seen nursing process, that is assessment, if you remember, nursing diagnosis, planning, implementation and evaluation. So all these things can be carried out if we know what is the problem of the patient. That's why admission time we always assess our patient so that we can give proper care to him through nursing care plan. Okay, so this is the main purpose. Next is, what are the principles which needs to be followed when we are undergoing the admission procedure? Okay, the first one is, sudden change or strangeness in the environment produces fear and anxiety. This is commonly there. Nobody loves to get admitted to the hospital, right? Everybody is happy. Yes, I'm getting admitted to the hospital. Never. Nobody will be happy. Everyone has some fear or anxiety, worry. They will be worrying that what will happen if I get admitted to the hospital. So this principle we should always keep in our mind, that patient may have anxiety. So solve or try to resolve all their problems, clarify their doubts and explain them whatever you're doing in order to reduce their fear and anxiety. What you mean by what I mean by this is, like, if you're taking your patient for some like the patient is admitted in the hospital, you're telling the patient that I want to give this medicine. So that's very nice thing that you are explaining him that I'm doing this, or I'm putting an IV cannula so that I can collect your blood, or I can even start medicines. Most commonly we try to put an IV, try to collect the blood and at the starting period, and then start our medications and all, or IV fluids and all. So here explaining him will reduce his fear and anxiety. And then tell him, please sir or please uncle, don't have any fear or anxiety. You can ask me any question if you require. You can call me. If you don't have any question to ask, you can please press the call button. Okay, are you understand? So here you are making him feel less anxious and less fearful. This is a very important thing which you need to do. Now here I am explaining for each of these principles what you need to do as a nurse. Okay. Next is, entering the hospital is a threat to one's personal identity. What you mean by this is, because once a patient is admitted to the hospital, he has to disclose his personal information. Yes or no? He has to tell the doctor, he has to tell the nurse that he is suffering from this problem from so many years. So it is a threat. It is a threat means his personal information is been shared. So what is our responsibility? To keep everything confidential. Okay, you're not going to share his or her personal information to anyone other than the medical personnel. Okay, this is very, very important. Okay, you're not going to share the information of the patient to anybody else. Okay, so that he feels safe. Okay, this is the second principle. The third is, people have diversity of habits and modes of behavior. Okay, now diversity of habits means not everyone will be exercising, not everyone will be doing some yoga or something like that. Okay, so when you are asking question, so if the person is saying I'm not doing any exercise, oh, you're not doing any exercise, you should not be like this. So you should never say such things. You should, as a nurse, never say such things. Okay sir, you're not doing it, fine. So you record it down, and then when you feel like that you need to give him health education related to exercise and all, you can give it. But don't judge him. Don't show your facial expression. Oh, you're like that. Never do that. Never ever do that. Because that creates a communication barrier between you, or we call this communication roadblock between you and the patient. Okay. And modes of behavior means what? Everyone is different. Okay, as you all are unique and different from each other, the same way our patients are also unique and different. You can't compare one person to other, so their behavior will be different. Okay, so remember this, that you have to first consider that patient or the patient is in difficult situation. He may behave differently with you. Sometimes he may get angry with you also. So that doesn't mean that you also get angry on him. Never do that, because he is in pain. He is in difficult situation. So as a nurse, we need to understand him. Okay, you need to understand his situation. Clear? And remember one thing, you are, as a nurse, we are healthy. Okay, he is not. That's why he is behaving like this. If you understand this concept, it will be very easy for you to take care of your patient. And remain first, very important as a nurse, we need to be healthy. Then only we can take care of other patients. Okay. So this is about people have diversity of habits and modes of behavior. Next is illness can be novel experience for patient and brings stress on his physical and mental health. What do you mean novel? New. Some patient may be for the first time having a particular illness and getting admitted to the hospital. Okay, I can remember during when I was admitted to the hospital because of one condition. So it was really difficult. Okay, so it is very difficult situation for us that you feel stressful, and that stress can affect your physical and mental health also. So what is our responsibility over here? What is our responsibility over here? To make them comfortable, to reduce their anxiety and make them feel that yes, you are going to get better. We are giving you this treatment and all. Okay, please don't give false assurance also. Those who are a cancer patient, stage 4 patient, cancer patients, stage 4 patient are not going to get well soon at all, because that is almost stage 4 we say is almost that the patient is going to die within 6 months or maybe within an year also. So don't give false reassurance to such patients. But such patients, you know that this patient can get well soon. For a dengue patient or malaria patient, you know that just when we give the treatment, the patient will soon, his platelet will soon rise up and he is going to get well soon. Okay, so according to your patient, please handle them and give them proper suggestions. Okay, so here in order to reduce his experience, always help him and guide him whatever you're doing. Just don't tell him, sit on this wheelchair, I'm taking you somewhere. Okay, you have to explain him where you're taking him. If you want to take him to MRI, if you want to take him for CT, explain him. Don't increase his anxiety, don't increase his fear. It's his rights. We are also going to see the rights of the patient. It's his rights to know what is the treatment going on him. It's his right to know what all thing or what all procedure you will be doing on him. Okay, so inform your patient. If your patient is unconscious, then inform the relative. Relative also has a right to know about his patient or her patient. Clear enough? Yes. Next is general instruction about admission. Okay, to receive the patient and help him to adjust to the hospital. It's very important. As a nurse, we receive our patient. Okay, we receive our patient. The patient may walk in the ward or walk in the ICU, or he's on a wheelchair and he's coming to you. So you receive the patient, always have a smile on your face and whatever you want. Hello uncle, okay, I will help you. This is the way how you approach them. Okay, and you take him to his bed. Okay, and you explain him, this is your bed and this is the locker and this is a room number which is given to you, or the bed number which is there. Okay, there are various departments and all, where in a good hospital we have, well then in one cabin there are only 3 beds, one cabin 2 beds. Okay, these are the various systems which are available. So you should make him understand all the hospital policies. Okay, and help him adjust. Remember, it's very difficult when you go to a new place. For example, you must have come to the college new. Okay, for the first time when you came to the college, it was very difficult for you. So with time, you started adjusting, right or wrong? So the same way here also, the patient needs to get adjusted to the hospital, and you play a very, very important role. As a nurse, we play a very important role in helping our patient adjust to the environment. Okay. To welcome and establish a positive initial relationship with the patient. This is a very important word which is added. To welcome doesn't mean you are going to welcome them like this. No, it's like just having a positive attitude. Okay, positive initial relation means what? You are approachable. When they call you, you go and talk to them and resolve all their doubts. You clarify all their doubts, so they feel good that there is someone who is listening to them. Okay, and if in the other part, let me take a negative. How can a negative way you behave? If the relative or the patient is asking, can you please just let me know what is it? आपको ये भी नहीं पता? So this is not a right attitude. This is negative. attitude which you are showing. You don't have to tell them that aapko ye nahi pata. You have to guide him. Yeah, this is a thing. This is a call bell. This is your bed. This is. You have to explain them. You don't have to tell them like this because they are new to the situation and you know about it. Are you understanding? This is very important. As a nurse, we explain everything to our patient, okay, and clarify even their simple to simple doubts so that they feel secure. They feel good that yes, I am in the right hand. I am in the right hospital. Okay, remember this. Next is to obtain the needed identifying data concerning the patient. This is very important. Here you are going to collect all the data which is required for the care of the patient, especially when we are talking about nursing care, subjective data and the objective data which you are going to get from health history, okay, and the physical examination, okay. So you need to do this. You need to collect the data so that we can provide properly the nursing care, okay. There are a few more general instructions. To collaborate with patient in planning and providing comprehensive care. So, you are not, what do you mean by collaboration? Collaboration means what? Involving your patient in the care. That is what I said in the starting. You can't sit here, we'll go there, and when he is asking you, I'm not going to tell you where we are going. This is all wrong thing. You have to explain your patient that we are planning to take you for an MRI. That's why I'm taking you down at our MRI area, okay, where it is done. Are you understanding? So you have to explain him everything. So that is called collaboration. You are involving him in the care. For example, you are giving a medicine, you tell them, I'm giving this medicine to reduce your pain. That is collaboration of care, okay. You can involve him or you can ask him what type of allergies you are having, any medicine allergies you are having, any food allergies you are having, so that I can inform further. And then we can provide you that particular diet and we can provide you that particular care, and we will avoid giving those medicines if you are allergic to anyone. Are you understanding? So that is collaboration. You are planning also and providing a comprehensive care. Comprehensive care is just not concentrating on the physical aspects, but we are also helping in his emotional and psychological aspects, okay. So that is comprehensive, involving many things. Next is to provide immediate care, safety and comfort. What do you understand by immediate care? Fast. For example, the patient is saying, मुझे सांस लेने में तकलीफ हो रही है. I'm feeling like I have breathing difficulty. Okay, uncle, wait, I will come. Huh? You can't say like that, no? You have to rush towards him, check his SpO2. If oxygen is nearby, is there, you start the person on an oxygen. Because why? That is called the immediate care. You just abhi thoda hoga, I will come back. This is not the way. Immediate. You should be very fast, vigilant. Okay, vigilant when you are caring for your patient. And the second word is safety. Safety means you provide him a safe environment. How can we provide a safe environment? For example, patient is in ICU, so we need to take care that should not be any infection given to him by someone who is coming from out, especially the visitors. So we always tell the visitor to wear some gown, or we tell the visitor to wear a foot cover, okay, to cover their shoes and all, so that they don't carry all the infection from outside towards our patient. And we always tell them to sanitize hands, right, or to disinfect their hands. It's very important so that we prevent cross infection. That is safety measure which we are taking, okay. And comfort. Comfort means what? Make the person comfortable. Okay, you ask him whether he is in comfort or there is something which is disturbing him or there is something else, because if he is comfortable, then only he will heal faster and then only he will recover. Okay, if he is not comfortable, there is something disturbing him, what will happen? The healing process will be slow. Are you understanding? So this we have to take care of. So the next general instruction is to observe, report signs and symptoms and general condition of the patient. Now what you mean by this is that we have to not only observe our patients, but also we have to see for we have to report it. So whom we are going to report? We are going to report to the physician that any changes is there, whether the patient is getting well or the patient is getting deteriorated, or what all thing is there, we need to every time report to the physician. Okay. Next important is the types. What do you mean by types of admission is that what are the ways through which admission can be conducted. So the first one is emergency admission and the second one is routine admission. Okay, so what is emergency admission? Clients are admitted in acute condition requiring immediate treatment. Immediate, for example, those who are having airway, breathing, circulation problem, we always say ABC is the first thing which we start or we try to care for. Okay, ABC is nothing but airway, breathing and circulation. When the patient is having any such emergency, that time he gets admitted. We call it as an emergency admission, where he goes to the casualty, and from casualty he may be shifted to ICU, okay, intensive care unit. Okay, so for what are the different patients who will be requiring and emergency treatment? Patient who is not able to breathe, patient who is not having much pulse or respiration, or the patient who is a road traffic accident patients who are not able to again breathe or having severe bleeding. So we try to consider them as an emergency admission. Next is a routine admission. Clients are admitted for investigation and planned treatment and surgeries. Now here, routine admissions are commonly carried on the hospitals, okay, either for investigation. As I said, if someone is admitted to the hospital just for getting or to do a full body checkup, and then also for some investigations like maybe PET scan, or maybe just for scanning, or just for any angiography, and also they get admitted to the hospital and carry out the procedure, and if required further, if they require, then they undergo the treatment or they get discharged. Okay, and the second common thing we get the patient gets admitted to the hospital is for any planned treatment and surgery. For example, if a patient is been diagnosed as having high cholesterol, and then he's been diagnosed as myocardial infarction, that is nothing but heart attack, so we will be admitting him to the hospital. Okay, now he is been planned for some surgery. Okay, so this is what here planned treatment means. A doctor has seen that this patient is now stable means he is not having much of the difficulty, but he needs to get admitted and take the treatment. If you have seen during COVID time also, many patients had to get admitted to the hospital and undergo the treatment, right? And many patients have to just get admitted for some surgeries, right? If there is some there is some tumor, or there is some like appendicitis where you have to remove the appendix. Okay, so the person has to get admitted and undergo the surgery. So these are the routine admissions which are being conducted in the hospital. Routine means routinely जो हो रहा है. Emergency में only emergency patients which require immediate care. Okay, hope so you understood the types of admission. Next is unit and its preparation. Whose unit? During admission time, what all unit and preparation which we need to do as a nurse. The first, it is the duty of the nurse to ensure that the patient unit is kept clean and tidy all the time. Unit means the patient where he is going to get admitted, we call the area as unit. That unit needs to be clean and tidy. It's our responsibility. Okay. Objectivities, and it's our responsibility doesn't mean that we are going to do. No, we have to tell the class 4 workers who are working under us to do all the cleaning and keep it clean and tidy. Okay. Objectives are to make the patient, why we are doing all these things, to make the patient feel safe and comfortable. Okay. To teach the patient the importance of cleanliness, orderliness, ventilation and brightness. Now what you mean by this is we are teaching our patient that first of all we are keeping everything clean and tidy. Once the patient comes, we also tell him that keep all his personal belongings inside the locker. Don't keep anything on the main table or main locker, you know, the small space which is there. Don't keep anything over there. Medicines are always kept inside. Okay, so this is how we teach him cleanliness also and orderliness, so that whenever we are taking some medicine, we should not get we should not see all the belongings of the patient there, because it's not easy for us then to remove everything and then take a medicine, right? So we always tell them there's a locker given to you, keep your, or a small cupboard is given you, keep it all your belongings, clothes and all inside. Are you understanding? So this is what, so we teach them cleanliness, orderliness, like how to keep order. This space is only for keeping medicine, this space for keeping only water. Are you understanding? And your food. Ventilation and brightness means what? We always, whenever a patient is admitted, there's a window over there. Okay, so there is a cross ventilation properly happening. Brightness, lights are there so that he doesn't have to be in a darker area. Okay, so we are just giving him this information. Next is to make everything convenient for the patient. The convenience means comfortable. Patient is not getting disturbed because of it, because of anything surrounding him. So it's very important, that's our responsibility. The patient is comfortable, at ease in the hospital. Next is unit and its preparation. May requirement in the patient unit. So what all thing we require in the unit? So patient cot with mattress, pillow and needed bed linen. So we require in the unit में क्या चाहिए हमें? We require a bed, bed के ऊपर mattress, then linens has to be there, yeah, bed sheets has to be there, then a bedside locker is there always, right? Then there's table and bedside locker. On the always we keep it on the right side of the patient. Stool or a chair is provided extra for the relative to sit. Fan, lights and windows. Okay, so you have fan, you have light, you have windows. Wash basin and toilet near to the patient's unit. This is very important, that there should be a wash basin and toilet provided near to the patient's unit. I remember the hospital where I have worked, I've seen one cubicle having three beds, and there was also a toilet attached. So there was in one cubicle there were 2 beds and 1 toilet attached. Okay, so this is what. And sometimes we had a general ward where we had for among 6 or 7 patients, we had a common toilet. So what I want to say is, according to the area where he has selected or where he is admitted, he will get the services, right? So but this all thing is required in the patient's unit. Next is daily care of patient's unit. So what all care we need to take? Now remember, it's not you who are doing every time, it is the class 4 workers who will be doing all the work. Okay, daily morning bed making. Yeah, bed making we will be doing for our patients, right? It has to be the linen has to be changed, the bed sheet has to be changed, and we properly do our bed making following the bed making steps. Okay, next is daily dusting of the entire unit with 2% Cresol. Cresol is nothing but a disinfectant. Ask the caretaker to empty the locker, clean it and teach them to rearrange their things in order. Now the cleaning and all with disinfectant will be done by the class 4 workers. Okay, they will be cleaning it up, and then you can tell the relatives to remove all the things which are there inside the locker, clean it and then again keep it well and arrange it properly. Next is arrange the unit with only what is required for the patient. This is very important, that is what I said, it should not be the whole bedside locker should not be filled with the clothes everywhere. No, tell him that remove all the clothes, you can give other, always we have a small cupboard like thing where they can keep all their clothes, and only the bedside locker has medicines or maybe water always there, and the food which he wants to eat or fruits which are there, anything what they are bringing that can be kept down. Okay, so this is very important. Next is in daily care of patient unit, sweeping, swabbing the unit is done in the morning. Sweeping and swabbing will be done by the class 4 workers, but it's our responsibility to see that it is properly done by them, so that the patient, there should not be bad smell, there should not be any dirtiness, because that will again create more problem and the patient is prone to get some other disease. Okay, it's very important that when a patient is admitted to the hospital, we don't give them written gift, right? What is the written gift we commonly give is hospital acquired infection. That should never be given from our side to them. Next is emptying the waste bag daily morning whenever it is filled. Okay, so that has been done by the class 4 workers, but it's very important you to see that it is not been done by them. Okay, so you guide them about it. Toilet and bathroom cleaning is done daily morning and whenever it is dirty. Okay, so this is, now it's why you should know all this, and you must be thinking why we are learning all this. Yes, because it is your responsibility, your patient. Na? Your patient should be comfortable. He should not always come and complain, you get this is there, this is not there, right? He should be in comfort, and that's why we take care of all these things. Ideally, all the class 4 workers are doing their work, but if there is something which is not done, you can guide them to do it. But it's our responsibility to see that the unit is clean. Okay, it's our responsibility to see the unit is clean for our patient. Okay. Few more points. Flush the toilet and sprinkle phenyl 4 times a day before 6 a.m. by 12 noon, 4 p.m. and 8 p.m. Now this is done by the class 4 workers, but this we should be aware enough, only for our awareness. Okay. Maintain discipline in the unit by controlling. This is under our control, where you are going to control the visitors. Why? Because what happens when the visitor comes and talks to the patient is already sick, right? When he is sick, someone is coming and talking, he feels more sick. It happens to some patient, right? So it's better that tell the visitor to come at a particular time period. Every hospital has policies. Either they keep it between 11 to 12 or in the morning 1 hour time, and in the afternoon in the evening it is 5 to 6 or 6 to 7 time. So please tell the visitor to come only during this time so that the patient is comfortable, and always never allow more than one visitor at a time. Always a hospital has such policies where they have that pass, okay, visitor's pass. Okay, at one time only one visitor is allowed with the pass and not more than that, because it should not create crowd in that unit of the patient. It's our responsibility to see that the visitors are not crowding near our patient. Okay, so maintain discipline, avoid unpleasant, unnecessary noise of music, ringtone of mobiles. Okay, unnecessary or unpleasant. Now, this is first is the noise or created by many visitors, so that can be restricted. Second is if there is some music, the person can't be using loud music in a hospital, right? If he wants to listen to music, tell him to use his own headset लगा के आप सुनिए, so that other patient is not get disturbed. Okay, so this is our responsibility to just request them. Okay, you can't order them or shout at them for such thing. You just request, sir, can you please use your headset so that the other patient are not disturbed? This is the way how you approach them. Okay. Few more daily care for patients unit. Prevent infection by keeping the unit clean. Instruct the visitor not to sit. This is very important. Huh? Commonly the visitors, when they come, they will just go and sit on the patient's bed. What happens, the visitor, we don't know from where he has come. You must be carrying many microorganisms and sitting on the patient's bed. Avoid it. Tell him that there is a chair there besides the patient's bed. Sit there. Okay. So they should avoid sitting, the visitors. Visitors should be avoid sitting on the patient's bed. Okay. Not to keep their bags, luggage, etc. on the bed. Avoid. Tell the visitors and even the patient's relative not to keep everything on the patient's bed. Patient's bed should be cleared. Only patient and the patient's pillow and the bedsheet should be there and nothing else. Understood? Yes. So this is our responsibility to prevent infection, right? To prevent infection to the patient, right? Next is avoid keeping any food open on the locker. Okay. So ideally this patients know if you are eating something, complete it up, or if you are not eating, close it up, because if you keep it open, what will happen? Either it may get stale enough or kharab ho sakta hai. Okay, so it's our responsibility to tell them that please don't keep it open, as you know it's an hospital. Okay, and very important, avoid bringing children to the hospital, small children. Okay, because they are less than 5 years of old children are more prone to get diseases because of the lower immunity among them. Tell them, not the visitors, not to allow any children coming into the hospital. Now, I'm not talking about a pediatric hospital. Pediatric hospital, there will be many children admitted, right? But here what I'm talking is if some adult is admitted and a child, so try to avoid that, okay? Ward sweeping is done twice a day. So that will be done by the class 4 workers, but you have to only look after it. Next, very important is the admission procedure. What do you mean by procedure? How is the admission carried out? The general instruction related to the admission procedure is nurses should make every effort to be friendly and courteous with the patient. This is very important. It's our responsibility that we should be friendly. Friendly doesn't mean that you share your numbers and get WhatsApp and each other. I'm not talking about that friendly. Friendly means your approach. Okay, you know what do you mean a friendly approach? If a person is seeing you, you have a little smile on your face and they feel good. And if you're looking, you're looking very straight in an anger face, no one will approach you. Why? Because you are not friendly. The look which you are giving makes them get scared of you. Okay, so that is friendly approach. You have that light smile on your face and then you are approachable. If they come and ask you, okay uncle, this is the problem, I will help you out. And ye problem leke aayo. This is not the way. You should not never get angry. Never get angry. Never show such facial expression which makes them feel, why did I ask her? It's better I never ask her again. Are you understanding? It's very important that we should be friendly and courteous in our behavior with our patients, so that they feel good, they feel safe in your, under you, they feel safe. If this nurse is there, I'm going to get well soon. Okay. So we'll see about the next general instruction. Make proper observation of the patient's condition, record and report. Okay, now what you mean by this is that when we are assessing our patient, we have to always remember this, record and report it. What do you mean recording? Write it down. Okay, write it down in the nurse's notes that this is the problem with the patient. Patient verbalized this much pain, or the patient has now vomiting. Anything, whatever you have seen on your patient, please record it down and report. Report where you are going to report. You report your sister in charge, you report the other person, that is your physician. Okay, so this is what. Next is orient the patient and his relative to hospital and ward policy. This is very, very important. You need to tell the patient that in this hospital, if outside food is not allowed, then tell them that outside food is not allowed. The visitors timing is this, so that they are aware, and then they are not going to break any rules as such. So please explain them the whole policy of the hospital, and also orient them to the ward or the area where they are admitted. Okay, tell them that this is the area where you are admitted, this is your bed, and you can use this bedside locker, this belongs to you now. Okay, so this is where you have to explain them so that they feel comfortable. Okay. Next general instruction about admission procedure is observe policies in dealing with the medico-legal cases. Now we will be seeing about medico-legal cases in detail. That time I will explain you what is medico-legal cases. Okay, so we have to follow the policies of if a patient is admitted with MLC, we say. Okay, MLC cases. Deal with the patient's belonging very carefully. Very carefully communicable diseases. Now what do you mean by this is deal with the patient's belonging very carefully, especially with communicable diseases means what? Here we are going to care for our patient's belongings. Belongings का मतलब क्या है? For example, if a patient is admitted to the hospital with such necklace or ring, so always tell the patient, okay, tell the patient to give all the belongings back to the relative. Never they should wear all these things and get admitted, and always not to keep all such belongings like money and all. Tell them to keep with the relatives itself. Okay, and you also give all this ornaments and all to the relative, and always record it down that given if you are giving to the relative, then you record it down in the nurse's note. That is yellow metal. We always write, we never write gold, silver, never write it down. Okay, because you don't know whether it's a gold or it's a silver. Always write yellow metal. Okay, for a gold, write it on yellow metal, and for our silver, write it on white metal. Okay, white metal ring or white metal necklace or yellow metal necklace given to the relative. Take the signature of the patient and the relative. Are you understanding? So this is what you need to do. This is not there here, this is below. So deal with the patient's belonging very carefully. Very carefully means what? Here you are not going to keep it with yourself, okay, because if your hospital is having a policy of keeping a locker, okay, safety locker is there, and if the patient doesn't have any relative, okay, and is alone admitted, that time if he requests you, then you please take his signature and keep it in a locker. But if a relative is there, then please give them, because we never keep any such ornaments on the patient. Okay, next is, and also other belongings also, other belongings means all his clothes and all, that we already gave him a locker or a cupboard like thing where he can keep it everything safely. Isolate the patient if suffering from communicable disease. Isolate मतलब अलग करना है. Those patients who are suffering from communicable disease like tuberculosis, we have now COVID is a communicable disease, right? So we are going to separate the patient. Don't keep them with other patient. What will happen? It will spread. The other patient will also start suffering. Okay, so we have to keep them separate. The nurse should recognize various needs of the patient and meet them without delay. This is very, very important, that if a patient is coming and telling you, please can you help me remove the IV line which is going on to him because he just want to use go to the washroom. Okay, I'm coming. Just don't say I am coming. Okay, just don't delay it, because he needs to go to the washroom. So just stop it and let him go. don't get so busy that you don't have time for him. Okay, and if you find yourself busy, then tell your sister in charge to give you a less number of patients, so that you can manage everyone properly. Okay, this is very important, that whatever problem has been told to you by the patient, try to solve it as early as possible, because then the patient will feel, what type of nurse she is, she's not at all caring for me. Okay, that's why. Few more general instruction: the needs to understand the fear and anxiety of patient and help to overcome. Now, we as a nurse, we need to understand the fears and anxiety of the patient and help to overcome. Ask them what is the fear, or what are the problem the patient is suffering from. Anything which is disturbing him, ask him, because fear will be, most common fear is what will happen after surgery, anxiety of what will be the outcome of the illness, what he's having. Clarify everything with him. The nurse should include the patient in his plan of care. We have seen this many times, that we have to include our patient in the plan of care. Plan of care means whatever care plan you are planning or whatever care you are giving, you tell them, inform them and involve them. The nurse should address the patient by their name and proper title. What do you mean by this? It's like title means either you're saying Mr. so and so. Okay, you are telling them by the name Mr. so and so or Mrs. so and so. And if you find it more comfortable, you can say uncle, auntie, sir, ma'am. These are all the most common thing which we say them. Okay, so please use such words and talk to them. That is what it means. Patient's valuable and clothes should hand over to relative with proper recording. That's very, very important. I said, please record it down that you have given it. Or what we do is, previously only when the patient is admitted to the hospital, we'll tell them, please give all your ornaments, all your important things to your relative itself. But if they are doing it in front of you, then if you are being a mediator over there, then please record it down, take the signature of the patient and the relative also. So now we are studying about admission procedure, how admission is carried out. Greet the patient and his relative, introduce yourself to them. This is a very common thing. Now, always when we meet someone, we say, good morning, sir, good morning, ma'am. So this way, good morning, uncle, good morning, auntie, myself, so and so, I am your nurse, or I am your student nurse, or I am the staff nurse who is going to care for you. Okay, so this is how you greet them. Now, greet them, please have a little smile on your face and then greet them. It's not in a very angry mode you're always. So have a little smile on your face and greet them. Okay. Next is receive the patient cordially and sit comfortably. So here you need to first, ideally I will tell you, whenever we used to admit a patient, once a patient used to come in the ward, we used to first tell them, yes sir, this is the room where you are, okay, and this is a bed which you are going to get. Before that, let me check your height and weight, because very important is that we used to do an assessment, okay, initial assessment which we used to do for the patient. So it's compulsory for us to write it down there, height and weight in the assessment. So we used to first check their height and weight and then let them towards the room. Okay, so look, room, once we take them to the room, we tell them this is your bed, this is your locker, okay, and this is a call button, very important, because in need, okay, if someone is not there nearby, you please press this button and I will come. Okay, so this all thing we used to explain them. And seat them comfortable, make them comfortable in the bed. And we used to always give them the clothes of the hospital to change, right? Because we have to always give the clothes which are there provided for the patient. So we give them clothes for changing. And the next thing what we used to give, we also had tags, patient tags we had, where we used to write the patient's name and the IP number and the patient, what you say, mainly sometimes diagnosis was written or sometimes IP number and the age or the gender was written. So that tag was there and the patient has to keep it all the time. Once he leaves the hospital, we used to, or once he is going to get discharged, we used to cut that. Okay. Introduce him to the other person in the ward. Now introduce your patient to the other person in the ward means what? Here, if it is a what you say, a ward where there's a units, okay, where there are cabins, okay, in cabins there are 3 patients who are lying down or 2 patients who are lying down. You can just introduce that, sir, next to you there is a ma'am or there is an auntie who is admitted with this problem, and let them see each other, and if they are comfortable and if they are what you say, they are feeling better enough to talk, let them. Otherwise, you can just tell them there's a patient lying down next to you who is a little sick. Okay, you can just help him know that there's someone next to him. That is very important. Next is complete the admission record. Now remember this, every hospital has a register, admission register. Okay, in that admission register, it's our responsibility to write it down, the name of the patient, IP number, the diagnosis of the patient. Okay, everything has to be written it down. And remember, when the patient is getting discharged, that we'll be seeing afterwards. Okay, so you have to write the reason for discharge, or that is he's feeling better or going home, whatever it may be the reason, you write it down and then sign. It's very important. Remember to write and record it down in the admission register. And very important, you will start making the file for the patient. File में आप क्या क्या रखोगे? Very important. The first thing is the assessment what you have done for the patient, where you will be asking him detail. Okay. That is collect history and carry out simple physical examination is the initial assessment what you do, and that has to be recorded. You also check the patient's vital signs. Okay, that has to be recorded. That's the initial assessment. Next is carry out the prescribed treatment and keep a record. Very important is, now here you are going to write it down all the, or perform all the care on your patient. All the care means at the starting when the patient must be met a doctor, he must have written down that the most commonly what we see is blood test which needs to be done, or he must be started on some IV fluids. Then you put an IV cannula, collect the blood, start some IV fluid. What all treatment, initial treatment is written down, start it. Okay, don't delay it. Very important, don't delay the treatment. Issue visitor's pass. Now about delaying the treatment, I want to tell you, avoid delaying the treatment because patient will get frustrated. Patient will think मेरे को अभी तक admit किया, कुछ treatment ही नहीं दे रहे. What is this hospital? What is this particular ward where I am admitted? So remember, inform them and tell them that this is going to happen, or this has been started, or it will take time. If there is nothing written on by the physician or by the medical doctors, nobody has written some treatment, then inform him. Don't just make him sit on the bed and not informing anything. That will disturb the patient. Remember this. Issue visitor pass means what? Every hospital gives one visitor pass to the patient. Okay, so the patient and one in a ward, along with the patient, one relative is allowed. Okay, so one visitor pass is given to them when anyone wants to meet the patient during the visiting time, as in the morning it can be, or in the evening time. Few more steps in the admission procedure. Help the patient maintain personal hygiene and change into hospital clothes. This is what I said already, that he has to, he has to change his clothing. Next is orient the patient to the ward, toilet, bathroom, drinking water supply, nurse's station and treatment room. Very important, once you have oriented him to the unit, you can, when the patient is coming, you can tell them this is the nurse's station. Nurse's station where the nurses are sitting. This is the, ideally in the cubicle where the patient is, there's already a toilet or a bathroom or a basin is there, that you can explain him, so that he is aware enough what is there in that particular ward or area where he is admitted. Hand over the patient's valuable, we have already seen hand overing the patient's valuable to relative. Encourage patient to take hospital diet, especially when therapeutic diet is ordered. Now, instead of just encouraging, most of the hospital nowadays has a policy that the patient doesn't have to bring food from outside, right? Whatever is been provided in the hospital, that is hospital foods, have to be eaten by him. Okay, so but some patient may find कि मुझे घर का ही खाना है, then we have to request the particular dietitian, and then if she says yes, then the person can be allowed. But there is a little policy followed by the patient. Patient has to go through a particular procedure in order to allow. But ideally, why we are telling hospital food itself? Because dietitian has been allotted and she will provide a proper therapeutic diet. Therapeutic diet means a person suffering from diabetes. She will provide a diabetic diet. Okay, low salt diet. Okay, so this is very important, that because dietitian knows what has to be given to this patient. Okay, that's why. Help the patient to maintain personal hygiene. Okay, we have seen this, sorry. Next is special consideration. What do you mean by special consideration? Very important special consideration. First is, now why we are studying special consideration? Only because in admission we should know what all thing is important for us. First is orientation to the ward. Orientation means we have to orient the patient to the ward. Okay, I've already told you how you're going to orient. The patient who is not very ill, this is very important, patient who is not very ill, then are allowed to move about and can taken around the ward. Those who are not too sick, we can tell them please come with me, I will, this we do at the starting itself. What am I starting means, जैसे patient आता है, we tell them that these are different cubicles and you are under this cubicle and this is your bed inside this cubicle. So we explain them everything. We don't then go and take him for a round. Ideally, when he comes, that time only we explain. Introduce the patient to him and vice versa. Introduce other patient. Okay, means you are going to introduce him with other patient, not the all patient. जो उनके बाजू में है, उनके साथ आप introduce कीजिए. If the person is comfortable, is not too sick. And to the other nursing personnel. Ideally, sister in charge. Ideally, we meet or make them meet our sister in charge, and then we take them to the area, to their own unit. Orient the patient to the whole ward, duty room, toilet room, and unit prepared for him. Ideally, we only orient them to the main unit where he has been admitted, so that he should know where he has to come back, or where if he is going somewhere means if he's coming out and meeting you, so you can just tell not to come out because you have a call bell there. Okay, and make him aware about his own cubicle. Okay, this is very important. Few more on orientation. After making the patient to be seated comfortably, explained the hospital policies and procedure and routine to the patient. His relative, tell him what is expected from him. Now this is what you mean by tell him what is expected. हम क्या चाहते हैं आपसे? The expected from him. Now what we expect is that he should not, if the hospital has a policy not bringing food from outside, then you tell him we expect that you please don't bring food from out. Second is, we also expect him not to bring many visitors, right? We also expect him that this is a no smoking area. This is just an example what I'm giving you. So it's very important that we tell them that ऐसा policy है हमारा, हम आपसे ये चाहते हैं. That is what we are explaining them. Explain to him the time for meal serving, the doctor's visit. Now, meal serving, if the hospital has a policy of providing food, then there's a particular timing. Like for example, I remember the hospital where I have worked, morning 8 a.m. you get the breakfast, then at 11 a.m. you get a brunch, then or 10:30, 11 you get a brunch, then at 1:30 around you get a 1 o'clock, 1:30 around you get your lunch, then again a snacks you get at 4, and then you get a tea at 6, maybe a tea or soup you can get by 6, 6:30, 8 o'clock you get your dinner, and at night time also they give a milk, that's around 10 o'clock. This is the whole timing which you should be aware enough, the hospital where you are working. Okay, very important. First, hospital policies and procedure you should be aware, then only you can explain someone. Okay, you should be aware enough about the whole thing about the hospital. What you mean by that is कौन से ward, कौन सा ward कहाँ पे है, which floor and all, everything you should know. Because if someone is asking you, you saying I don't know, this is very wrong, because you are working in that area or you are working in that particular hospital. Next is doctor's visit. Okay, there's always a specific time when the doctor comes for the round, and then two different doctor come at different rounds, right? Some doctor comes at 10, some at 11, some only in the evening time, 6, 7. Okay, so when the doctor is coming on round, that you should explain him, not all the doctors, especially his doctor under whom he's been admitted to the hospital. Visiting time, that I already told you, every hospital has a different visiting time, mostly in the morning one time and in the evening one time, that you should be aware and explain him. Prayer services, if any, very rarely, but if any prayer services have been provided, you can explain them. Okay, and any other hospital routines which are there, you can explain him. Next is care of belongings, very important. Care of belongings means जो भी उनके पास सामान है. It is always good policy to discourage patient to keep valuable things and money with them. Okay, जो भी important सामान है, please don't keep with you, give it to your relative. Send the valuable to home through, it's better to send it through the relative back home. If he doesn't have anyone, this is what I said, अगर उनके पास कोई, if there is no one with him and he is alone, okay, enter the description of item in the register. you please record it down in a register that these are the belongings which we have taken from the patient. Why? Because the patient can't be wearing ornaments and sitting. He has to remove everything. His ornaments he has to remove. Okay. So if relative is there, we'll send with a relative, or if we are keeping with us, then please remember to write it down. Yellow metal, white metal and all. Okay. Never write gold and silver. Never ever write it down. And send the valuable to the office for safe or for a safe custody. If your hospital has some locker system, then keep it over there and give the keys to him. Get the patient. This is very important. ले तो लिया, signature लेना है. Please take the signature of the patient in the register that we have kept it safely. Or if the patient is illiterate, take a thumb impression. Clear enough? This is very important. And always, if you are taking it and giving to the relative also, take the signature, okay, so that it is a proof. They should not come and blame you afterwards. So that's why we are doing all these things. Next, very important is the roles and responsibility of nurse in admission. As a nurse, what is our roles and responsibility? Okay, a nurse has an important role to play in the reception the patient to the hospital. The following are the purposes of this procedure. Let us understand first, before roles and responsibilities, also responsibility, but what are the purpose behind we are doing this admission of the patient? Prepare the patient both physically and mentally for a stay in the hospital. Prepare karna hai. We have to prepare our patient for the stay in the hospital, because nobody likes to stay in the hospital, right? So you have to tell them this is the thing which is happening with you, or this is what I am doing on you, or I am giving a medicine. Okay, so make it comfortable for him. Yes, it will be painful. You are putting an IV cannula, it is paining, but make it in such a way that it is not too much harming the patient. Okay, you can say yes, it will little prick you when I am inserting a needle, it will prick you, but we have to give you, in order to reduce your pain or to give you an IV fluid, you have to explain him so that he feels comfortable. Okay, next is to help the patient be comfortable and provide him with a clean and safe environment. The environment where the patient is lying down, see to it is safe and clean also. Cleaning will be done by the class 4 workers, but you can guide them whenever required. To give a good impression of the hospital and service, that the patient will fully cooperate with the treatment and nursing care. Very important, good impression. Now here is not that we are just marketing or something, no, but the patient should feel good about whatever care has been provided by the nurse. Okay, so that he has a good impression. He feels, I know this hospital, even if I am admitting again, I will come to this hospital only because the services which was provided was the best. Okay. Next is, a nurse must receive the patient kindly, sympathetically, and with an understanding of his illness. Remember, the patient is sick. Okay, so understand that he is sick. He is not able to take care of himself. That's why he is admitted. Agar wo acha hota, he will never come to the hospital. He will sit at home and take care, na? So understand, you should have this sympathy. More than sympathy, you should be empathetic. Understand it and care for it. If he is too ill and needs immediate attention, what you mean by this is, agar bahut bimar hai, give him emergency treatment. If not, then routine treatment has to be started. Next is, and if his emergency treatment is required, then transported to the ward. Emergency treatment means mostly emergency treatment we give in the casualty, send him to the ICU and then back to the ward once he becomes stable. Okay. Next is need for orientation to the place and person. This is almost the same thing. We are coming back. But as a nursing responsibility, you have to write it down in detail. You are going to orient him first to yourself that I am your nurse. This is the sister in charge. This is your doctor. They must be knowing, because under whom they are getting admitted, they almost decide, right, under whom they want to get admitted. Okay, and then also orient him to the area. We have seen the orientation, and this is the important thing or important nursing responsibility. This both are most important. You have to do admission assessment. Assessment means what? आपको head to toe assess करना है. Physical examination and health history. History you have to take and record it down so that we have the initial assessment with us. Clear enough? This is all about admission. Hope so you have understood. Let us move on further. Next is medico-legal issues. Okay, so let us understand what is medical legal issue. Let us more than medical issue, let us understand what is MLC. Okay, medico legal case. MLC का मतलब होता है medico legal case. is a patient who is admitted to the hospital with some unnatural pathology and has to be taken care of in congruence. Incongruence means साथ में, parallel with police or court. Now what you mean by this is, there are many MLC cases. We always say MLC case है, मतलब क्या होता है? Those patients who are been admitted to the hospital with a let me give you an example, road traffic accident. Now road traffic accident is an MLC case. Why? Because we don't know the reason behind the road traffic accident. Okay, that's why we have to miss. It can be an accident, or it can be someone must have hit the person, or it can be a murder case. We don't know, no? Such cases where we have a question mark whether it is been related to something which is something or someone has caused it, or someone is doing by himself. We say suicide, homicide, or any rape victim. This all are being considered as an MLC case where police needs to be present because they should be aware enough what is happening with the patient. Are you understanding? We will be discussing about different cases which are called as MLC, but you should be aware enough. An MLC case needs to be handled properly. Properly means for every patient you handle properly. The files, very important, the files. Files needs to be kept separately. Separately means recorded properly and written it down. File के ऊपर हम लिखते हैं. We write it down on the file. MLC. That means the reports and the records of the patient are not been given to the patient. Once the patient get discharged, na, we never give them. We always give them MLC case ka Xerox. We only give them the Xerox of the investigations or not. We never give them the original file. Original file is always kept in the hospital. This is very important responsibility of the nurse when she is handling an MLC case. There are many other also will be saying about it. Okay, so hope you understand MLC case is nothing. A case is nothing but a patient who is admitted with an unnatural. Unnatural means natural nahi hai pathology. Natural pathology means having dengue, malaria is a natural pathology where a mosquito is biting you and you are getting a disease. Chikungunya, or you say hypertension, or the natural pathology. Unnatural. Unnatural means which doesn't look as natural. Such type of condition will be declaring them as medico-legal. Where legal issue can occur, that cases we consider as a medico-legal cases. Okay. And remember that has the taken, that what you mean by taken care, has to be taken care in parallel. साथ में मतलब पुलिस को बता के आपको सब करना है. You have to inform them this thing is happening with the patient. Okay. So what are the types of client which are categorized as MLC in a hospital? तो कौन से patient को हम बोलेंगे MLC case? What are the different clients? The first one, very important, commonly RTA, we call it as road traffic accident. Okay, RTA. Next is any injuries inflicted during मतलब fighting, many person who are two are fighting and then admitted. Okay, or shooting. Okay, someone has shoot someone. Okay, I remember during my time there was one patient admitted where he was shoot. Okay, he was a builder. He was a builder and he was shooted by, there was two gunshot injury. One on the chest and one on the intestine it had region, and that's why he had developed a colostomy. So this is a shoot case. It was an MLC case. Okay, bomb blast. Okay, this all cases will be considered as MLC. Along with that, suicide. Okay, homicide also. Homicide means what? Killing of one person by another. Burns. Now why burns? Because someone must have burned the person. That's why. In order to rule out the cases. Poisoning. Commonly, poisoning are most commonly MLC cases because people try to kill themselves by drinking poison, right? Rape victims and the assault. Assault may be, there is nothing but people are torturing someone, or you understand what is assault, no? You are physically torturing someone. Remember, assault doesn't mean only physical, it can be mental also, where you are making the person go in depression or something, can be considered. Okay, so remember these are the most common cases. Now why you have to remember this? Because once you start working as a staff nurse, you should be very much careful. Their reports, all the investigation which are done, for example a poisoning case, poisoning case we always take the sample. Okay, we do nasogastric aspiration, we take the sample from the stomach and keep it separately. Why? In order to test what he has drunk or further investigation. So all such samples, reports has to be kept safely, and that should not be disclosed with anyone. किसी से share नहीं करना. You have to only share with the physician and the police who is going to come. Clear enough? So remember all these cases. Next, very important, what is our role and responsibility whenever an MLC case has been admitted to the hospital? Okay. Now remember one thing, once a patient is admitted, he is conscious enough or maybe unconscious, these are the responsibility. But if a patient is admitted death, he आपको admit किया, he has died. So what needs to be done? Please inform the police, okay, that this patient was brought dead to the hospital. This also has to be informed. Clear enough? Because they should be aware that this patient was brought and he was dead and he was not alive. Please inform the police and your chief medical officer also. He will be checking on the patient and they will be, but see to it that they have been informed. The police has been informed. Okay. Next is, these are the roles and responsibilities when the patient is admitted, he is conscious or unconscious, but admitted to the hospital. Okay. Obtain complete history from patient or significant other. Now, what you mean by this is, let me take a poisoning case. Example. Poisoning case है, तो you need to ask them, poisoning कैसे हुआ, किसने क्या खाया, उसने क्या खाया था, what happened after drinking or eating it, what happened. You have to ask the detail because that has to be recorded. Even the doctors will be also recording, but you also have a small record of it. Inform, this is very important. Inform the police officer or constable. Ideally, every hospital has one constable on duty in the hospital. Okay, if not there, the nearby police station needs to be informed about it. And the chief medical officer who is there in your unit. When it is made an MLC, then record it on the patient's case. This is very important. Can you see here? It is said to record it down. Now this is a file. ये हमारा file है. On the right hand side, यहाँ पे top corner, we say the right hand side, top corner, you are going to write it down with the red ink. I mean, I am already writing with a red pen. So write it down with a red ink as MLC. So that everyone is aware. Not everyone is, other patient won't be aware that files are kept in our nurse's station, right? So physician is aware or any other nurse who is coming for caring for the patient, because you will be for only 8 hours duty and the other nurse will be coming. So they should also be aware that this is MLC case. This is commonly done. Okay, remember this also. This also you need to do. Okay. The other role of a nurse is, do not give, this is very important, do not give any statement about patient's condition to police or registrar or media. Only a doctor is to give information from your side. Media also can come if a person who has some film star or some big actor or some politician, someone who is a good personality, who is famous enough. So media people can be coming. So you don't give any statement, because till now the doctor will be deciding after seeing the investigation and all, that what is the report. So from your side, you don't give any statement. See to it that the physician should be there to inform about the patient to the police and the, now what you are going to inform at the starting period, we saw that we have to inform the police that such case has come. We're not going to explain everything. Let the physician do it. Okay. When a patient has to be discharged, inform the police. This is very important. You need to, this is what after, when he is going to get discharged, also see to it, you need to inform the police that this patient is getting discharged. After clearance from others, this is very important. Once they said, okay, you can leave him. Now, why we have to inform them? Because if there are some cases against him, okay, matlab he must have tried to do suicide. So this is wrong. According to law, you can't. Okay, this is only in the hand of God who can take your life. You can't take your own life, right? So if such cases there, the police maybe wanted to keep him in jail or something. So he has to be, or about him, we have to inform them. Okay, they should be aware. Every time what happens, we don't call them as such. Mainly our sister in charge informs our nursing superintendent can inform to the police. Okay, the next thing is during discharge also, every day, or as such we take it before discharge, every day the police comes and asks about the condition about the patient. They do it. Their responsibility is, okay. And when they give clearance, okay, this patient can be discharged, then only you make the person go. Okay. Next role of a nurse is if an MLC patient absconds. What do you mean by abscond? Bhag gaya. Okay, abscond means a person has gone from the hospital. Inform the CMO and again the treating doctor immediately. And you should also inform the police कि वो यहाँ से चला गया. He has, very rarely this happens, but if it happens, हो गया तो. No MLC patient can go, okay, leave against medical advice. Okay, they can't leave the hospital by signing that I want to leave this hospital and go to some other hospital, or he just want to go home. They can't go like this. Even if they want to go, then the whole policy has to be followed where we have to inform the police, we have to see the doctor's consent. But ideally, MLC cases are never allowed to go against medical advice. Okay. Document the care given to the patient timely, accurately. This is very important. You need to record everything properly because that is a legal document. Ideally, all our records are legal document, but this becomes very, medical legal case becomes very important because that if some case happens, then this will be carried out further in some court cases. Okay, so it's very important that you record down everything properly and sign on it. Few more roles of a nurse: records and all documents pertaining to patient and his care during his stay in the hospital must be kept safely, should be handed over to authorized person as designated by the hospital authority. Now, this is what I was saying. All the records of the patient needs to be kept safely, and only when the patient is getting discharged and hospital, the patient means the physician has allowed him to go, and our police has also said yes, we can discharge him, then we can only and only give him his xerox of all the records. You can't give him original document, remember that. In case of death of an MLC, the body is not, this is what I am talking is if the patient was admitted in the hospital and he died in the hospital, so we are not going to hand over the body to the relative, only of an MLC case. Why? It needs to be accurately labeled and sent to the mortuary. CMO or the police officer should be informed simultaneously. After informing the police, if the police says yes, then only we are going to hand over the body to the, because why? Because we may need to do some post-mortem or some other thing. If they say, police says, then we have to do it. So it's very important that you don't directly send the body to the relatives. Okay. So you have to follow the procedure, especially for MLC cases. Okay. Hope so you have cleared about medical legal issues. Important is MLC cases. Remember the different cases and then provide care to them. There's nothing such big issues over there. Care has to be same as other patient, but records has to be proper, and never give original things to the patients. Okay, and the records and documents should only be shared with the medical person, not with anyone. Remember to maintain confidentiality of everything about the patient. Nobody should know about him. Okay, nobody should know about him is nobody should know what is the case, what was the problem, why he did, okay, why he had done suicide, or why he had eaten a poison. All such things should not be shared with any other patient. A patient lying next to him also should not know about it. Are you understanding? This is what we need to maintain our ethical principles. Clear enough?